Yeah, we'll do the research review.
Video is on.
Good.
Testing 1, 2, 3, 4. Test. Good.
4. All right.
Test.
Hello.
Check, check, check.
Check, check.
Yeah, good.
Okay.
Good, good.
Excellent. Let's get this party going.
Wow. Are you just about done?
And you got the
You
video.
gotta know where everything is, okay?
Okay. Oh my God.
Yeah, Welcome to Move to Improve. My name is Dr. Matthew Jurgis. We have with us,
Dr. Alex Fitzowich.
Dr. Greg Uchez.
and we got, this is a big topic for us today because this information really isn't anywhere. Unless you're somebody that, well, okay, Greg has a question.
Is it a big topic or is it a small topic that is, it's a simple topic?
It's a simple topic.
It's a no-brainer topic, but it's got a big kicker to it or whatever you want to call it.
There's confusion around it. That's what it is.
Yeah, and of course, we're talking about cervical manipulation and the risk of stroke. This has been in news. This is, it's kind of been a point of contention. It's come up. And it's not something that I am trying to talk about with my patients typically. Unless they're curious, it's not something that comes up. But I know there are a lot of people that are wondering, and I think this conversation should be available to people who are curious, that want accurate information. So I've spent, I've probably prepared for this podcast more than any other podcast, spent a good bit of time accumulating all of the most pertinent research when it comes to cervical manipulation and the potential risk or correlation with vertebral-basilar artery dissection. Now, I think a good place to start is, what is that? What is a VBA dissection? And so basically, you think of your artery running up the length of your cervical spine to your brain. Your artery has multiple layers, and what more or less happens is there's a separation between the inner layers of that artery and the outer layers, and blood can get in between there and kind of separate that further. Anything you guys would like to add in terms of what that is? That makes sense, right?
Yeah, no, makes total sense. And yeah, exactly. It's separation within the layers. This is not like a breaking of the artery. This isn't it's not what you're thinking of. It's a very specific thing.
Because dissection sounds...
like a dissection.
That sounds weird.
Yeah.
So there's 4 possible scenarios that are proposed by people that could happen as a result of cervical manipulation therapy. One, that there could be a catastrophic break. This is the presumption that we'll get into. The other is that it's congenital, right? You're born with an artery that is basically
Defective.
Yeah, and that does happen. The other is cumulative. It's cumulative effect that can happen, adjustment, or whatever, trauma after trauma after trauma, cumulative until things break. Coincidental meaning we know that the vast majority of dissections are what we call idiopathic, meaning spontaneous. There's no obvious cause. Most people that have it, it just can happen one day, and that's a little bit scary for sure. So there is the coincidence of somebody coming to see a chiropractor when they're already on the brink of having this issue. Now, there's a bit of good news to come along with that, and that's the majority of people that have strokes caused by cervical dissections have good outcomes. In fact, 70 to 92% survive. A good portion of that survive without residual issues, although there are, obviously some that could have lifelong residual problems. Now, Now, neck pain is pretty prevalent in the general population. It's estimated about 30 to 50% of people are gonna have neck pain within a given year. And that's going up because our just higher coincidence in more advanced countries because we're sitting at computers and desks all day. We're not really using our body as we should be.
Hey Matt, just to take a step back, can you relay those numbers one more time with respect to the risk mortality associated with cervical dissection?
Right. So if you have a cervical dissection, there's 70 to 90. This is based off of one number that I've gotten, 70 to 92% survival rate.
Yeah, it's just important because I think the vast majority of people feel that if you, if you have this incident, that there's a massive mortality rate with this, right? Like we're killed. Like if you have a stroke, there's a lot of people that die from stroke, right?
Yeah.
So upwards of 92% survival rate.
Yes.
Yeah.
Yeah, and this isn't like there's lots of ways you can have a stroke.
Good point.
And this is one.
Yep.
And this is not the most common one. Well, there's the numbers going to come up later here, but it's like 1,000 of the amounts. If there's 1,000 strokes, it's like 1 or 2 of that amount. And if dissections are more common in younger people when it comes to strokes because there's not as much other risk factors like atherosclerosis, other things that could be causing strokes. As you get older, there's more variables at play.
Yeah, I think that's an important distinction, is that a lot of people, like when they think stroke, they're like, oh, that's what my grandma passed away from, or whatever it is, but it's like, this is not even what we're talking about. This is something, this is something completely different, much more rare, just not what you're thinking of when you think of a stroke
Just
necessarily.
one of.
Yeah, just one of.
One potential, different kinds of strokes out there.
Yeah.
So, different strokes for different folks.
Yeah, great.
So, first, I'd like to talk about a bit, I'd like to talk about this study to start off. So, effects of cervical manipulation on vertebral artery and cerebral hemodynamics in patients with chronic neck pain, a crossover randomized control trial by Moser and Noseworthy and Mior.
Do you know where this was done? Who did this?
Who did this?
Well, we know who did it. Like, who did the studies? Like, what were the credentials of the people?
Yeah.
Sorry, I'm kind of throwing you under the bus.
Okay. I mean, like I can look up the study.
Yeah. I guess the whole point of it is I'm trying to let the audience know that I felt like you did quite the amazing job of really encapsulating the research to try and be unbiased and to kind of give an overview of where all this is coming from, because these are the major studies that were undertaken to investigate this, right? And a lot of them had a hypothesis going in that there's like that HVLA, high velocity low amplitude thrust, or cervical manipulation is causative of vertebral basilar insufficiency, right? And dissection. So anyway, I just wanted to make the note that
it matters. It matters who it's coming
this
from.
This is not biased chiro research.
For sure.
Came out saying,
For sure.
No.
Because the whole point of this, like, spoiler alert, is to show you all the audience the evidence out there and just dispel the myths of this whole thing, right? And these are, you're probably gonna do what, 5, 6, 7 of the largest studies ever. Like, one of them's the largest study ever conducted in healthcare, for God's sakes. Like,
Huge.
Patient years. So, anyway, you don't have to look it up. I just.
Yeah. No, that's a good point. You just want to be aware of like where this is coming from, like whose perspective, like 100%.
Yeah. I have the study open right here. I could look through this to find out like who exactly funded this, but
where was it published? Top abstract, about the abstract. Sorry, guys.
This is the Imaging Research Center at St. Joseph's Hospital in Hamilton, Ontario, Canada. Okay?
Yeah, from a hospital.
Yeah.
Hospital in Ontario.
Primary care.
Yeah.
Okay, gotcha. So, the hypothesis was that cervical manipulation may increase the risk of cerebrovascular accidents. And so what they've done is they've used MRIs to look at haemodynamics, which is the study of blood flow through your arteries and then therefore into your brain. So they're checking both the artery and then the cerebral vascular hemodynamics, therefore into the brain. And so what they did is they compared during cervical manipulation to your neck in a neutral position, which is just a normal still position, to also your neck at maximum rotation. And these were patients that had chronic neck pain, right? That helps kind of eliminate some other variables.
So the visual people in the group, right? Neutral versus full rotation versus in a position to get your neck adjusted, which is some degree rotation, lateral bend, and extension.
Yeah. And then therefore also that full on adjustment.
Yeah.
Okay, so let's quickly go over what the supposed mechanism, the vasospasm hypothesis that was placed, because they're trying to explain, how cervical manipulation could potentially cause this problem. And so the hypothesis is that putting your neck in rotation and hyperextension during manipulation leads to considerable stress and stretch forces on the vertebral artery, specifically at C1, C2 at basically the top. The mechanical compression of stretching the vertebral artery may lead to changes in blood flow, and the subclinical injury to the vertebral artery may lead to thrombosis. So basically they're saying that putting that neck in an adjusting position where you adjust them could cause a spasm in that artery, could change the blood flow, you could develop a blood clot in that artery as a result, and therefore either stroke then or stroke from a cumulative effect of this.
And that's the hypothesis.
Yes,
right?
That's not what it said.
That's not the results.
Yeah.
That's what they said they think they're going to find.
Yeah.
Yes.
Or
Very
could.
clear distinction of
Yes.
what's a hypothesis here.
Yeah.
Right? Important to know that.
Yeah.
So, what did they found? Well, they found that the vertebral artery blood velocity was the same in maximum neck rotation versus cervical manipulation. Adjusting your neck, in fact, I believe there was less changes in cervical manipulation, but the point was there was no significant difference between either.
Yeah.
The other point is there was no significant changes in blood perfusion to the brain compared to neutral position or maximum neck rotation. Changes were found to be non-meaningful and suggest that cervical manipulation, this is in the research, cervical manipulation may not increase the risk of cerebrovascular events through a hemodynamic mechanism.
Yeah, and so what that actually means, like in layman's terms, is that the stress that you're putting on that artery would be more just turning your head to the side fully than actual adjusting or anything like that. And so that it's what we're doing in the clinic is not putting the same amount of stress or blood flow or any of these different markers that they were looking for compared to just turning your neck all the way.
With respect to blood flow.
With
Yes.
respect to blood flow.
Yeah.
Just want because there's other
Yeah.
studies that test other
There's
things.
other things too, correct.
There are
Yeah.
other
We
things
want to
to
say
consider.
that, so far so good. First study, major study done.
Yeah.
That shows that.
It's not the blood flow.
Yeah, it's not blood flow that's an issue.
Yeah,
But
correct.
and this was 20 patients, so there's
fair enough.
there's other studies we're gonna look at. This
Yeah.
is not the whole story by any means.
Yeah.
Okay. Now the next study, this one is really cool. This is by Symons, Leonard, Herzog, and we're talking about internal forces sustained by the vertebral artery during spinal manipulative therapy. This was in the Manipulative Physiology journal, and we're talking, they took 6 vertebral arteries from 5 unembalmed cadavers. So we have 5 cadavers, they used 6 arteries, and what they did was they put,
Strain, yeah.
Yeah, they've used strain gauges. So just to give you a heads up, Walter Herzog is the director of the Human Performance Lab, University of Calgary. He's a biomechanist,
Yeah.
a world-renowned biomechanist, and he kind of took it under his wing to study this. It's Alex, you've been down there, like.
Yep.
So at the Foothills Hospital, there's a sub basement, and this is a little bit of a secret, but there's like almost a full zoo down there. It's crazy. That's where they do all the research in all these rooms. And,
That's pretty cool.
yeah, it's very restricted, right, to get down there, but that's where there's tons of research that goes on down there, and Dr. Herzog's got a lab down there, and that's where they did these cadaveric studies down there.
And essentially very unbiased too, because he's not a chiropractor and he's not a primary care physician or anything. He's a researcher.
Yeah, he's fair to say he's a biomechanist and very, very well established.
Yep.
man
Absolutely.
In the literature, yeah.
Okay, so when you read this study, you think, well, 6 arteries, that's not a lot of people. That being said, we're talking people that died of cardiovascular disease at age 80 to 99. They had their arteries, like the surrounding structures of their arteries, dissected out. So if any artery was ready to pop off and fail, it would be these people. We're talking people that are already dead. Like,
Yeah.
Could I also make a comment that it is extremely challenging to get the unembalmed vertebral arteries of recently deceased people. Like, there's such a demand for cadavers for doing research studies. To actually pull it off, like, is actually a miracle, like, to get that. So having 6 was, because I was kind of part of that, right? So it was, having 6 was actually, okay, here we go. Okay,
Yeah.
here we go. Yeah.
And these are people with multiple risk factors, right?
Yeah.
Super old, with disease that is a risk factor, and on top of that, it's literally just the naked artery. Like, this is not the same at all as when it's in your body.
Yeah.
This is very literally exposed.
Much less pliable.
Yeah.
Right, they died from cardiovascular disease.
Yeah.
Okay, so the basically the hypothesis, the potential kinking or pinching of the vertebral artery during neck movement can cause a vasospasm to the artery, and therefore can dislodge a thrombus, which is a clot, or an embolism, or cause a traumatic tear in the artery, and that would cause a stroke, right? So what they found was, first of all the adjustments, they tried 4 different adjustments basically, and what they found is the adjustment that put the most amount of stress on that vertebral artery where it's said to dissect at the distal end was an adjustment to the lower neck, because when you adjust somebody's lower neck, you put them in a lateral flex position, and just putting them in that position alone is putting stretch on the artery. Now, when they did the adjustment, they found between 1.3 to 6.2% stretch on that distal loop. Okay, so
that's a maximum of 6.2%. So that means that if the resting length then is 100%, when they get adjusted, that length then goes to 106.2% maximally. So an extra 6.2% stretch, right?
Yeah, that's the amount of stretch or strain put on that artery.
And then, just to add to that, what's anatomical? What stretch do you have to get to anatomical failure?
Before I get there,
okay, sorry,
and I will, the amount of strain put on that artery during range of motion is 1 to 12%. Okay, so with whenever you adjust someone, that upper limit was, I believe, 6%. You're still within that normal range that you are, which is consistent with the last study we saw. That range of motion it puts a comparable amount of strain as adjusting your neck. Now,
so range of motion was upwards of 12% stretch, so beyond resting.
Yeah.
And manipulation was 6% beyond
Correct.
resting.
Exactly.
Correct.
The average that it took to stretch beyond resting length to create mechanical failure was 53%. So you're stretching it
Almost a little bit over extra half.
over half, yeah.
Of the full length, yeah.
In these bodies, we would have to assume that a live person
It would be more.
Probably a lot more than that, but yeah, 53%, and that was between 139 to 162 range. So there was variation between different arteries, but that being said, on average, an adjustment produces 1/9 of the strain required to produce mechanical failure in vertebral arteries in this population.
One ninth, like orders of magnitude, like not even close.
So I know that we talked about some of the studies you're going to talk about. Are there other Herzog studies in there?
No, I think it's just this one.
Because I just want to follow up on that. Because I remember going through this. So they said, okay, like they did them on I think just healthy bodies, and then they went to atherosclerotic patients, right, cardiovascular disease, and then they actually did more studies. I don't know if it was male, female, and then they did more studies on repetitive, right? They strained it like, over the course of 20, 30, 40 days, like times, or then they did over days. Like they did all these different studies to just address all the different aspects of how the people would challenge this. Because they
just to see what it was.
Yeah, they really wanted to see, okay, so what are all the challenges here? What are we going to see? Is it, repetitive strain? Is it, how much do we take it to anatomical failure, et cetera, I just remembered, I'm an old guy, and I remember going through all those times of the studies of Dr. Herzog. Yeah, interesting.
Yeah, and I mean, each one of those studies is like, okay, we're looking at one small section of what's going on. And so it's like, okay, well, it's 9 times more than it needs to be. Okay, but what if we put this limitation on? What happens then? Still no.
Yep.
What about this? What about this? What about this?
So far, in the studies we're looking at, this is a non-issue.
It's looking good.
Let's continue.
Yeah, 0 for 2.
Still not going to say this is the be-all, end-all. There's
Nope.
lots of other studies to look at, and there's maybe studies that I haven't included in here that somebody else in the audience might want to bring to my attention, and
I'd love that,
100%.
That would be awesome,
love
yeah.
people
Because
to.
I don't think there is. But
I don't think there is, but I would love it, and just because I want to know what else is out there.
For sure.
Okay, next study. Risk of vertebral basilar stroke in chiropractic care. This is a population-based case control and case crossover study. And this is David Cassidy. He's a chiropractor, but with...
Yeah, he's also a PhD, right?
And PhD, yeah. And then the study was done with a whole bunch of other MDs and PhDs. So yeah, this is a big study.
This was the largest healthcare study ever conducted, period, full stop, end of story, right? Like, look at the authors.
Mm-hmm.
Yeah.
There are neurologists, there are physicians, there are PhDs,
Yeah.
there are chiropractors, there are public health, MPH people. They're like
Big names.
Yeah, they decided. I remember this one too. They basically tried to be as inclusive as they possibly could with every healthcare professional that would have vested interest in the stakeholder piece of this. So I remember this. You'll see there's tons of authors of this thing, right?
Yeah, all of them have PhDs at least. Most of them have multiple things.
And they studied 109
from everything.
million patient years, right? Is that what it was?
I mean, which is amazing. It's amazing to see like different practitioners working in harmony to really get to the bottom of this. And so it sparked the reason, this was a priority was there's 2 deaths in Canada from vertebral artery dissection following chiropractics in the 1990s that sought a lot of media attention, and so there were neurologists called to avoid neck manipulation for acute neck pain, and so some questions had to be answered basically. So most cases, we already went through this a little bit, most cases of vertebral artery dissection occur spontaneously. There are other factors, we're going to get into this later, but connective tissue disorders, migraines, hypertension, infection, cervical spine surgery, or potentially trauma. Anyways, let's move on. So yes, it's 109 million patient years. So they did this over 9 years. They found 818 VBA strokes hospitalized in a population of more than 100 million person years. The results of the study was there was no association between chiropractic visits and VBA strokes in people older than 45. There was an association found for under 45 population. there was a positive association found between people that saw their primary health care provider and had VBA strokes in all groups. And so it's important to note that the point of the study was to compare seeing your healthcare provider, your physician, your MD, your medical doctor, to seeing a chiropractor. Because we know that most people that are going to have a vertebral artery dissection will have neck pain. We'll go in, I have it written down there a little further down, but I think it's 80%. Like within a week, you'll have some neck pain, you'll have maybe a headache, and that's caused to either see your medical healthcare provider or your chiropractor. So it's important that the study is comparing between the two. Okay, so there is a positive association between seeing a healthcare provider, physician, and VBA strokes, but we know that, again, people see their healthcare provider.
Yeah, they're having symptoms.
They're having symptoms.
Yeah, they're having symptoms. They know something's wrong.
Exactly.
Yep.
And what was the difference between primary care access and chiropractic care access for increased risk?
Yeah.
It was the same, right?
Yeah, I mean, the association was the same, except chiropractics did not have that association over 45.
Yeah.
Now, it's important to note that the VBA cases aged under 45, we're looking at a lot of people here. They found 13 patients that saw chiropractors within 30 days of their stroke.
And that's out of the 109 million patient years, like 13 in that age group. That's crazy.
13 in that age group. So that's what we're saying is the correlation, right? That comes down to 13 people. In the primary healthcare provider, the physicians, it was 46 patients, okay? And so that was 12% of those that saw chiropractors and 45% of those that saw their PCP. Interestingly enough, none of the patients that saw chiropractors had strokes within 0 to 3 days. Within that window, it was all within 7 to 30. Which I think is important because it's going to come up later for another study.
Correct.
And so basically the conclusion was the increased risk of VBA stroke associated with chiropractic and PCP visits is likely due to patients having neck pain or headache from the VBA dissection and are seeking care before their stroke. We found no evidence of excess risk of VBA stroke associated with chiropractic care compared to primary care.
Yeah, and that's an important distinction because people are like, what's causing this? What's the timeline of this happening? People thought it was see the doctor and then this happens, but what they found out is it was actually this was already happening, and it going to your doctor was after, because this is what was already happening.
Yeah, well, that's, we're getting in the weeds here with all this data and research, but yeah, we need to talk it over, right? And yeah, so a plausible explanation for this is that patients with neck pain or headache due to dissection seek care for these symptoms, which precede more than 80% of VBA strokes. So that's the number. 80% of the time you're going to have that neck pain or headache, and you're going to see somebody.
Yeah.
Hopefully. Okay. So we have not ruled out this conclusion. We have not ruled out neck manipulation as a potential cause for VBA strokes, but on the other hand, it is unlikely to be a major cause of these rare events. Okay, it's really, really impossible to completely rule something out, but at the very least, we can rule out as a major cause.
It just drives me funny.
I know that drives.
I'm sorry I'm so biased in this discussion, but I've dealt with this for so many years. I actually had a physician tell me that in this study that showed a definite correlation between chiropractic spinal manipulation of the neck and stroke. I'm like, well, what study were we reading? Like, what are you talking about, right? Like, it shows that any access to a health professional has a slight increased risk. And when we talk about sliding, we're talking like, in the order of less than 15 to 20 people over 100 million patient years. Like what?
We're talking about like hit by lightning type numbers here, like lottery ticket numbers.
Walking across the street and getting hit by lightning twice, types of numbers.
Yeah.
What? But what they took out of that study was that chiropractic care had a correlation with stroke. I'm like, So I have a little bit of a, like you can
Yeah.
see all the way through, I got a bias, but I'm an old guy and I've dealt with this for a long time,
It's it's hard not to get bitter.
right? And I'm
sure.
sure that we're gonna get into this, like doing other types of approaches and the massive increased risk associated with doing something other than getting your neck adjusted to help with your neck pain, which we know that high velocity longitude thrust and manipulations and emotion treatment, like, okay.
And we're gonna get
we're
gonna get there, Dr. Hugh. I know you're fired. I'm fired up, but
He's been dealing with it for 30 years. Like, I don't blame him.
I've also just had my head in this research for a long time,
Yeah.
and I want to make sure we get it all out
Fair enough.
in a hopefully non-biased way.
Yeah.
Spinal manipulative therapy is an independent risk factor for vertebral artery dissection. That's the name of this study by Smith, W.S., Johnson, blah, blah, blah.
Can you read it again?
Spinal manipulative therapy is an independent risk factor for vertebral artery dissection. Just the name of that
So
study.
that's not leading anybody.
That's not deceiving by any means. So they took 51 patients. Okay, basically what they did is they combined the databases of two stroke centers. They picked two stroke centers, combined the databases, evaluated a great number of patients over the years of 1995 to 2000, and selected 151 of those cases of people that had strokes with a dissection. And then they matched those cases to 309 controls that had strokes for other reasons other than a dissection. I know that's a little confusing, but they looked at these two centers, found 151 that had strokes related to a dissection, and then matched it with 306 that had strokes for other reasons than a dissection.
Yeah, everyone in the study had strokes, even the controls. Controls is kind of misleading in this one.
Yes, and finally we have our number, 2.6 per 100,000 strokes are from dissections. Okay, and there was a little bit of a difference in the age. There was the controls were 6 years older. It kind of matters, but not really.
2.6 out of 10,000 were dissections.
Yeah.
Yeah.
And that's 100,000 strokes. That's not 100,000 people.
No.
That's 100,000 strokes.
10,000 or 100,000 strokes?
100,000.
So 2.6 out of 100,000 strokes are dissections.
Yeah.
Yeah.
Okay.
Super rare.
And it's, you know, if you're gonna have a dissection, it's more likely to be in a younger population.
Correct.
Okay. So,
But the dissections are extremely rare compared to all other strokes.
extremely.
Okay.
Okay, so SMT performed within 30 days of stroke was independently associated with vertebral artery dissection. So basically what they found is that in the dissection group, they were more likely to see a chiropractor than people that had strokes for other reasons. Okay, and they found there was 3 other variables independently associated with dissection. Head or neck pain was a big one before stroke, the use of alcohol consumption, illnesses. Anyways, so they found that. Now, what they highlighted here is that 10 of those patients, so it really came down to 10 patients saw a chiropractor before their stroke. 3 of them were the controls, 7 of them were the dissection patients. It's really not a big number.
No.
And so we know that younger people are more likely to have dissections too. Younger people are more likely to see chiropractors, yada yada. So 10 patients in total saw a chiropractor within 30 days. So they're saying that the 3 patients that had strokes that were in the control group saw on average the chiropractor 8.4 days before the event, where the 7 patients saw it closer to the event 1.36 days on average. Now they're saying this is a big deal because there's a closer temporal relationship to the people that had the dissections and them seeing the chiropractors. Again, we're talking about 7 people here. The other interesting thing is that other study we just mentioned that looked at 100 million people
How many patient years?
100 million
Yeah, patient years.
Sorry.
Yep.
None of them were within 0 to 3 days.
Yep.
I've seen a chiropractor under 45.
Yep.
Right? None of them. So that's what they're saying. They're saying that's an independent risk factor. The study has some limitations. Basically, the limitation is people that signed up for this study or responded to the solicitation were more likely to participate if they were motivated to disclose the perceived cause of the stroke as related to chiropractic care, right? They're more likely to partake in the study and to remember that they saw a chiropractor if they're associating that chiropractor visit with their stroke. And I'm not saying that it's not impossible. Like, we know that it's not a major cause, but if you're on the brink of a stroke and you get adjusted, is it possible that that could have been the straw that broke the camel's back? I don't think that's unreasonable, yet we know that's such a small margin based on the research.
Yeah,
right.
Well, the basic research suggests that it's not even a small risk, right? Like, we're at 6.3% increased length of a resting state. We're nowhere near the end anatomical stage. We're like, you know, rotating your neck and end range movements are far more tension to the tissue than getting manipulated.
Yeah. But it could have been like that amount of margin could be them looking to the right all the way. You know what I mean?
Yeah. Well, in fairness, they could have went for a haircut and got their haircut, or they got their hair washed in the sink before they came. You know, to the clinic too to get treated, right?
Yep.
So
barber chair stroke. Yep, that's a thing.
That's a thing, right?
It's a thing.
Yeah.
It is a thing.
Sorry, again, my bias all coming out on this.
No, by all means, I think, yeah. So yeah, that's the study basically. Now there's, I think maybe 1 or 2 more studies I want to talk about. They did this study. They basically did the same study where they did, you know, in Ontario. They took a huge number of people. Now they did it in the U.S. It was chiropractic care and the risk of vertebral basilar stroke, results of a case control study in the U.S. with commercial and Medicare Advantage population. So 2 populations, and they didn't find any association with chiropractics and strokes, and they made a point based off of the past study to separate above 45 and below 45. And so in the study, there was no association.
You know what sample size was?
Yeah, so they took those populations of people over 2011 to 2013. It was comparable to about 5% of the total U.S. population. From that, they took 1,159 VBA strokes and matched it with 4,600 gender match controls in the commercial sample. It's really two populations. And then they took the Medicare Advantage healthcare people. They distilled that down to 670 stroke cases and 2,600 match controls. Okay.
Again, this is 5% of the U.S. population over a course of 3 years. Like, this is another very big study. This is a lot of cases.
Yeah, and they found a significant association with their primary healthcare provider and VBA stroke incidents, but not in chiropractic.
Was that 15 million people-ish, 20 million people-ish?
Yeah. Yeah, for 3 years, that's another 45 million patient years.
Yeah.
All right.
It's very big.
Yeah. Conclusion of the study was manipulation is an unlikely cause of VBA stroke. The positive association between PCP visits and VBA stroke is more likely due to the patient's decision to seek care for headache and neck pain symptoms associated with the dissection. We conclude that using chiropractic as a measure of exposure to manipulation may result in unreliable estimates of strength of association with occurrence of VBA strokes.
I think that's the biggest one. Like, again, this study is essentially saying the same thing. You have headaches, you have neck pain, it's because you're having a stroke or you're at risk. You go see either your doctor or your chiropractor, but it doesn't matter which one. Mm-hmm. Positive association just means you're reporting these to those doctors.
And it's funny because in the under 45 population, that there's 2 people that had strokes that had seen chiropractors, and it was in the 15 to 30 days prior category, none of which were in the 14 or closer to the event date. Okay, so
last one.
what
We're getting there.
are, yeah, I know, thanks for staying with us.
We're getting there. It's a good
It's
one.
a lot of information, but it's information you should have the right to, right? Because this information isn't readily available, and it's a lot to kind of gather, right? So this is our sixth study and our final one. Risk factors and precipitating neck movement causing VBA dissection after cervical trauma and spinal manipulation. So they looked at 367 cases, 160 of them were spontaneous, 115 were after spinal manipulation, 58 after trauma, and 37 after major trauma, okay? And what risk factors did they find? Well, the biggest one was hypertension, then migraine, well, no, not the biggest one. The biggest one was oral contraception, actually. If you're on birth control, that's the biggest risk of a spontaneous, or of any having a dissection. Then hypertension, migraines, and smoking. So that's a thing to take note of. It was especially bigger in the spontaneous group. Hypertension and oral contraception were highly prevalent. Now you might look at that and go, well, if that's less of a risk factor in people that had spinal manipulative therapy, does that mean that spinal manipulative therapy is more of a risk? You know what I mean?
Mm-hmm.
But it's so marginal. Yeah. Anyways, I think we've kind of got into the nitty gritty enough. So I have just one last important detail important piece of information I found, which is that NSAID use, which is your Advil, the Motrin type stuff, used for osteoarthritic neck pain has a 0.4% risk of serious complication and a 0.04% risk of death from gastric hemorrhaging, resulting in 3,200 deaths per year. So if you're using your Tylenol or your Advil, not Tylenol, Advil, that's a 0.04. If you're using that regularly, that's a 0.04 risk of death from gastric hemorrhaging. If we're saying that cervical manipulation could cause strokes and death, if we're saying that's true, that's still 100 to 400 times more likely risk or prevalence of serious complication than getting your neck adjusted as a treatment specifically for neck pain.
And that's a huge discrepancy. Like it even, you even said like the risk rates for NSAIDs, those are considered very rare. So much so that you don't have to sign a waiver when you take ibuprofen or an Advil. Like it's so rare people don't even think about it. And for getting your neck adjusted, it's 100 to 400 times more rare than that.
Yeah, that's what it is.
It's such a small number.
Yeah, and that's why we want to have this conversation, is because just the fact that like everybody should have access to the information, and like the fact that it's on that consent form, and I think that's a little spooky. I think it's a little misleading. Does it have a right to be there? Yeah, sure. There is. This is the research though.
Yeah.
Like, this is the correlation. It's very small. Sure, throw it in there. I think that's reasonable, but really understand that it's not like a clear causal factor.
I think the numbers game is a big factor in this one, right? Like people see it on the consent form as kind of one of the categories, and it's like, okay, but really is that, looking at the numbers, it's like, well,
right.
That's not
so
what
like
it
if
is.
you or your friend or somebody had a stroke and you go to the hospital and one of the first questions they ask you is, have you seen a chiropractor? Like, is that fair?
Yeah.
To us?
Yeah.
To be throwing that in there?
No. What do you think about that, Greg?
Greg's lost his mind.
This drives me fucking crazy. Okay, so I'm certain 25% of the adult population see chiropractors in Alberta. So if somebody goes in and has a stroke, and they go into emergency and they see a neurologist, and one of your intake questions is, have you seen a chiropractor? Guess what? Like 1 in 4 have. Like,
yeah.
so how is that that's like saying, oh, well, you know what, you should wear running shoes because there's a less incidence of people who have a heart attack who wear running shoes.
Yeah.
Ergo, running shoes decrease heart attack. That's ridiculous. That's
Yeah.
just a correlation because you have healthy people. The thing is 25% of your adult population is seeing chiropractors. Like, you're going to have a 1 in 4 with that thing. There's like, I hope that the listeners like gain some appreciation of the magnitude of the research that's been done on this topic, both from basic science and an epidemiological aspect. And they realize that these were the largest healthcare studies ever conducted, ever. Like 109 million patient years. I mean, what does it take to disprove something, for God's sakes? So my problem is that I have patients that say, oh, I don't want to get my neck adjusted, I'm not going to go see a chiropractor with my neck pain or my headaches, I'm just going to go and take some Advil. Okay, but rough numbers, you get 1,500 people. So if you take regular ibuprofen over a 3-month period, rough numbers, 1,500 people are going into emerge bleeding out the bums. Rough numbers, 50 people are dying from taking regular amounts of an ibuprofen, Advil, Motrin, those are all ibuprofen. This is the risk. I just looked up this Harvard Health thing, and it basically said, talking about Tylenol, Tylenol and risk factors. There's an article on it. It says tens of thousands of, this is a summary, by the way, tens of thousands of people become ill every year from taking too much acetaminophen. In smaller number of cases, several hundred per year, that's a smaller number of cases, it leads to death. But it need not happen to you. Read the labels and stick to the guidelines. Blah, blah. So in small numbers of several hundreds. Here's another one. Tylenol. Taking too much acetaminophen can damage the liver, sometimes causing the liver to transplant or death. Okay. As much as 92% of people from stroke recover. Okay. Yeah. Like, so when you have people that are not undertaking this specific type of treatment. Now I get it, it's creepy, it's loud, it's in your ear, you're taking your neck to
That's
end
an
range.
important point.
It has a creepy feeling to it, I get it. But if we have a realistic appreciation of the evidence that's been produced here, and we know the evidence on the clinical side is, listen, like cervical manipulation is one of the most effective, if not the most effective thing in relieving neck pain, and we're avoiding it because we have a perceived risk associated with this. So we go home and we take our Advil or our ibuprofen or our Motrin or our Tylenol. Like, are we not kind of misleading our patients when we're doing this type of approach? Yeah. Are we increasing the risk? And then we're not helping them because we're actually killing pain response. Like, I would argue against anybody trying to tell me that ibuprofen is an anti-inflammatory. Prove it. Show me on the bottle where it says it's an anti-inflammatory. Show me where in the marketing where it says it's an anti-inflammatory. You have to take my understanding of this, you have to take 4 times the amount, the recommended daily dosage to get an anti-inflammatory effect. It's a painkiller. It's an analgesic.
The other thing is, are we trying to kill inflammation? If inflammation is the first step
Healing
to
response,
right?
yeah.
Inflammation
It's
has
also,
to precede
another
healing.
name for inflammation is a healing cascade, right?
Yeah.
Is a healing effect. Anyway, we can go into the weeds and all this stuff and how we heal injuries and whatnot, but for fuck's sakes, like, let's get real about the topic and have a real discussion about, is this a risk factor? Let's look at all the other things that other professions do and what they risk and what they get away with in getting their patients to do, and really have that discussion whether or not we should be telling their patients don't go see a chiropractor because they kill people or they're going to cause you to have a stroke. Nobody's killed anybody. Nobody's like, and we've disproven the stroke thing, but I get it almost every day in my practice. Like, someone says, yeah, oh, amazing, you fixed this, you fixed that, you fixed my knee, my ankle, my hip, my low back, oh my God, between my shoulders, thank you for fixing that shoulder, that impingement's into my head, but don't touch my neck.
Yeah.
It drives me up the wall, and it's all because of misinformation and misdirection. And we need to have a real discussion about this stuff. Anyways, I'm sorry I'm biased about this topic, but we deal with this every day. I'm an old guy, I've been around forever, so I've dealt with this forever.
Well,
ask other professions, like, let's disclose it. We're, $1,700 a year or something like that is our malpractice insurance. I'm sorry, but if we cause stroke in people, if we had a risk of causing death or stroke or paraplegia, oh, you're gonna cause me to become a paraplegic, like, seriously? Like, I'm a quad, like, this never happened, like, ever.
Yeah.
Would my malpractice insurance be that amount every year? Like, yeah.
Yeah.
So the narrative is so frustrating.
Yep.
Yeah, and it's like, how much more do we have to do to say definitively?
Yep.
Because the correlation will never be zero, because when people have a dissection, they have neck pain and they seek care from a chiropractor or from a PCP, but they're going to seek care, and that correlation will always be there. But we have a plethora of information and research telling us that it's just that, or it's just marginally above that, where there's no.
We had two of the largest healthcare studies, like the data points, right? Like 109 million patient years, and the other one, ever conducted. Like that's a statement, and you still have people going, well, yeah, but maybe they didn't control. No, like they did, right?
Did.
And we also had like 30 authors from like 20 different professions, and it just gets frustrating after a while to always defend. Right?
Yep.
It's like, but I had this one patient. She went to Chiron. Boy, she had a stroke, and I know it's much higher. Yeah, great. Yeah. Right, and which is okay if we really did still sense that risk. But what we're doing instead of, which have higher risk but are perceived as less risk, aren't we just misleading? And it really bothers me. And we have to get past that whole, it's a creepy procedure piece, right?
It seems barbaric.
Yeah, and honestly, the narrative thing is a big thing. The don't touch my neck. I don't want to get my neck adjusted. I get it, like whatever, maybe you're not comfortable. I get it. Have you ever had that for a low back or a shoulder or literally any other area of the body? No. Never. Yeah. Never. People never think about it. Ever crack your knuckles? Ever do this? Ever do that? Nobody ever thinks about that.
No, I'm getting a little fed up with the whole asking you going into emerge and getting the have you seen a chiropractor?
It's ridiculous.
Yeah.
It's just like we're just perpetuating misinformation.
And the media hasn't done us any favors either, because they're Anyway,
I'm sorry, I'm biased about it, but just anybody look at the research. Hopefully, maybe you can post this with it. I don't know.
Well,
or find other real studies. Find other real studies, not an N of one.
Yeah.
Real studies that show either side of the argument.
Right.
Happy to get any information that's not been collected. Bring it.
So I don't normally post citations because that's not our podcast. Our podcast is to be kind of palatable and not really dive into the weeds. But this time I will, and I do want to hear back from other people. I'm not in an antagonizing way. Like, if you have other information that you think we're missing, if you don't think we're being fair to the argument, and even if you think there is a small margin, and hey, maybe, like I said, maybe somebody's on the brink of a stroke, super rare case, could it be a potential thing that takes it over the edge? I'm not even opposed to that potential, but I think that it's very misleading to say that anything beyond that, right? And so that's the research, guys.
Yeah, like a real, just instead of somebody going, no, chiropractors kill people, you come back with you want to have a real dialogue, happy, right? Mm-hmm. I mean, the evidence is there. Just prove it.
And people are also so bad at estimating relative risk.
Yeah.
Right? You go home, you take your Tylenol, you don't think twice about what's happening internally. I get it. You grab onto a neck.
Yeah.
That looks scary. I
like your word, barbaric. Yeah, it does.
It does. Yeah. And but there's true benefit in that, and the benefit of chiropractic manipulation has been shown repeatedly. People that have gotten it done know right away that it's effective. But we're 52 minutes in. I don't think I have anything else to add. I think we got over it.
I have one more thing. Sorry. I just want to let everybody know. You know how when some dude in a movie totally rotates somebody into snap?
Yeah.
And they instantly die, right? They just wilt to the ground and then they're dead. Okay, that's not real. Right, that's
no,
it's not real. The amount of force it would take to do that is not Sylvester Stallone strength. Okay,
that's silverback gorilla strength.
Yeah. And then two, you wouldn't just die, right?
Yeah.
You're cutting off phrenic nerve and cervical plexus, in case your diaphragm's gonna stop. You're not that. You're gonna have actual consciousness for a little while here, right?
Movies are movies.
Yeah, I just want to let people know.
Yeah, that's a good one. I get that question too.
I know. Really? That's just not a thing. Right?
No,
it's a movie thing.
Yeah. It's not just Pez dispensary just pop.
Yeah.
It's not that, guys. It's not that. Anyways, thank thanks for the audience. If you guys have made it this long and you stuck with us, you're genuinely interested. We hit a milestone recently. We're well over 1,000 downloads, so we really appreciate all the support. But without YouTube, with YouTube it's more than that. If you want to bring anything to my attention, I really would appreciate that, and you can do that on our Instagram, move2improve_pod. Please reach out. Any other research, any other questions, any other thoughts, like totally open to discussion. And I think that's it. So thanks, guys.
Yeah, thanks.
All right.
It's great.
Is that good?
It's great.
Yeah, that was good. No, I wanted you to come in hot at the end.
Yeah. That's what you said. Wait to the end, okay?
I was blazing.
And I want to let everybody, like, I'm totally biased, because I'm always like, hey, wait a minute, can you, and that's obviously a biased approach, but it's like, fuck off already,
Move sideways,
I gotta fuck. Okay, good talk.
That was a good one though.
I will see. I'm thinking of like just the absolute shitstorm of response you're gonna get on this if it goes viral.
That's the thing.
I would love that.
That's the thing. We're like we
Yeah.
might be under siege with like the college or something if this gets big.
Yeah.
Why?
I don't know.
Why is it a college thing?
Fuck, I don't trust
You
it.
just send the research.
The thing is, like, honestly, if you see any big, like, Cairo video on YouTube or Instagram, there'll be comments like that. It'll just be like, oh, Kairos kill people. Kairos don't work.
Yeah.
That causes stroke. And it's, like, literally the most uninformed,
Yeah.
like, troll comment.
But you
and
know
it's
what?
like, bro.
There's companies that pay for troll farms.
Oh, yeah, dude.
They have bots that go around spreading information. in the
2016
comment
election,
section.
man.
Yeah.
Yeah.
I know. And I never thought of it that way.
But it is.
But a medical company could totally do that. A drug company
Oh,
could
they do.
totally do that.
And they do.
Yeah.
Fuck yeah.
They did to the energy system.
Well, yeah,
Gas.
yeah.
It's totally, it's very well documented, right?
Yeah.
Some of the big companies, they paid Greenpeace and they paid, there was like 80% of the protesters were paid protesters or something like that. It was like some ridiculous number.
Yeah.
Anyways, guys, I got a roll. Got my next thing to go to. That was good though.
That was good. I hope
Yeah.
we didn't get too dry there in the middle, but I think
No, it's good.
it's good.
It's good.
we had to be a little bit.
And if they make it to the end, they're gonna see the old chance for rant.
Just
rant off. Let's have a real discussion about this, right? I think that was fair.
I think it was fair too.
Yeah, I think we'll see if it'd be great if this went viral, wouldn't it?
It would be. I'm gonna send this to a lot of people, so
Yeah. Get it going.
as you guys should too.
Yeah. Well, I should get James Kim to send it to James Kim. Yeah. Yeah, he'd love that. Okay, thanks, boys.
You?
Do something. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, 32, 33, 34, 35, 36, 37, 38, 39, 40, 41, 42, 43, 44, 45, 46, 47, 48, 49, 50, 51, 52, 53, 54, 55, 56, 57, 58, 59, 60, 61, 62, 63, 64, 65, 66, 67, 68, 69, 70, 71, 72, 73, 74, 75, 76, 77, 78, 79, 80, 81, 82, 83, 84, 85, 86, 87, 88, 89, 90, 91, 92, 93, 94, 95, 96, 97, 98, 99, 100, 101, 102, 103, 104, 105, 106, 107, 108, 109, 110, 111, 112, 113, 114, 115, 116, 117, 118,
Yeah, I never thought of the troll farm thing, but for like medical companies, it's like, well, it's already been proven that it happens in politics. And that was a huge thing, 2016 election, blah, blah, blah. It's like, well, if this is a thing, why would it not be a thing for every single aspect of everything?